My name's Kate, and I was 7 years old when my mother died. We were living in Australia, and I remember those days in snapshots. Snapshots of the sea, running to Mum, dancing on the beach and counting the seagulls. And one day, as we walked along the beach, she told me she hoped I'd have a brother or a sister soon. But as she spoke, a dark cloud seemed to pass over, and a brief gust of cold drizzle sprayed over us. A seagull landed in front of us. I was scared, so Mum picked me up and raised her hand. The seagull flew away. And we walked on home. We were happy. We had just got into the kitchen when Mum dropped her bag, saying she did not feel very well. I asked if the seagull had frightened her, but she just laughed nervously. Suddenly she started to cramp over with pain in the belly, and then she collapsed. I ran to get Gwen, our neighbour. The world went into a spin, and then an ambulance arrived. Mum was taken to the hospital, and Gwen and I followed in her car behind. Mum waited on a trolley, and a doctor came. It seemed as though he knew her. The doctors did some x-rays and said they were normal. And then it seemed as though Mum got better. We were waiting for Dad to arrive to take us home. Suddenly, Mum rolled over onto her front. She was in pain again, and then she seemed to go silent. She went pale and shrank to stillness. She seemed to be draining from life. And doctors and nurses came quickly, and the action seemed to become urgent. Then her heart stopped. They pumped my mum in the chest, and blew in her lungs, and thumped her chest again, and again, and again. And then she seemed to come back to life. Her heart was beating again. Then more doctors came. People were rushing everywhere. They said she was going to have an emergency operation. And I was shut in a room, on my own. I sat and waited. And then I heard people crying. A doctor came and sat with me too. He said his name was Greg. He had tears in his eyes and looked drained and pale. Like us, he was English. He sat on a chair, slumped back. He could not look at me, but he said he was sorry. He said nothing else. Finally, Dad arrived. He'd been too late to say goodbye to Mum. He picked me up, took me home. And under the stars that night, he said that the angels had taken Mummy to heaven. And in that fateful southern sky, we saw 2 new stars twinkling at us. That was in 1988. Soon after that, we returned to England. I remember that Dad flew back out for an inquest. They said that the doctors had made some terrible mistakes, but that was it. Mum was never coming back. When I was 15, I was looking for something in my dad's study. I found a report. I did not understand it then, but I did remember the seagull. Dad saw me reading it. "You could have had a brother," he said, "but we lost them both." "I wish and wish and wish that the doctor had thought to do a pregnancy test," he muttered. And we never spoke of it again. Life moved on, and I now have young children of my own. Sadly, Dad passed away last year, but he saw me safely through medical school and my junior doctor years. I'm a GP now and work in the Oak Tree family practice. There are 2 of us. Gregory Black's my senior partner, and me, Dr. Kate White. Gregory had asked me to join the practice after we met at a GP trainers meeting several years ago. During my training, I had rotated through a urology and gynecology firm. One day, 2 of my bosses held an infertility conference between the 2 departments. Although I had been involved with both male infertility and andrology clinics, they asked me to give a token lecture about pregnancy testing. I was terrified, but afterwards, a senior GP came and shook me by the hand. That was Greg. He told me that he needed an expert in men's health problems, and suggested that I apply to work in his practice. Of course, male health problems, erectile dysfunction, infertility, and anxieties about testes and sexual problems had never really been on my professional horizons. Whatever he was thinking, the important point was that I was really chuffed. I can even remember my presentation to this day. It went something like this. Once a sperm has fertilised the egg, cleavage occurs to form 2 cells, then 2 cells divide to 4, 4 to 8, until eventually the morula is formed. At this stage, all cells are totipotential. Gradually, a cavity develops in the cell mass, and soon we see a discrete inner cell structure that will form the embryo. The outer cells are known as trophoblasts. The whole structure moves towards the endometrial lining, and the trophoblasts stimulate an anchoring reaction. As the embryo burrows into the maternal tissues, the trophoblasts produce a chemical called beta-HCG. Detecting beta-HCG is the basis for the pregnancy test. Ultimately, the trophoblasts will form the placenta. We can measure beta-HCG in the blood or the urine, and both are very sensitive tests for pregnancy. So Greg was impressed, and in 2007 I joined his practice. As planned, Greg soon had me doing the Wellman Clinic. For my sins, I did this once a month. Most of the time, I was simply seeing anxious men with achy testicles, or men worried about their failing erections. Of course, most of the time, I was simply prescribing erectogenic tablets. Not surprisingly, the drug company was very supportive of these clinics, and Greg had eventually persuaded them to buy us an ultrasound machine. It became a bit like my toy. Once a month, a properly trained radiologist would come to Oak Tree to do a diagnostic list. At other times, I would find myself scanning men's scrotums on a sort of self-learning quest. To be honest, most of the time, it all just looked like a snow globe to me. I never really became competent to use the scanner, and in truth I felt uncomfortable offering this as a legitimate sonographic service. However, it usually helped to give peace of mind to those anxious men who had aches and worries in their genital regions. Greg knew of my feelings. "Don't worry about being a charlatan," he said. "Your scans are invaluable in allaying the anxieties of the worried well." And so, despite my own self-doubts, I was swayed to carry on with a practice that rested uneasily with my deeper intuitions. But what turned out to be a much more tragic irony was that Greg often used testicular analogies to describe his own diagnostic philosophies. They had an importance for him that I was to understand more fully later. But these analogies were an eerie testament to how his own working practice was shaped, and this is what he once said.
Testes, like differential diagnoses, tend to come in pairs. Normally, we make diagnosis A rather than diagnosis B. Usually, it is straightforward, and more often than not, we are right. However, sometimes we go with diagnosis A, although we are not really sure. If we are lucky, then we may get it right. And sometimes, we just get it plain wrong. That's just the way the world turns, and we get on with it. But a different and profoundly unforgivable situation is when we go with diagnosis A, but we have a nagging feeling that it is incorrect. Really, we want to go with diagnosis B, or any other diagnosis, but we've been swayed by others, or by circumstance, or are too proud to revise our diagnosis. Challenging our original assumptions, or even those of others, is not an easy or a natural thing for a doctor to do. But deep and visceral intuitions send us warnings. If you peek where there is doubt, you may find a disaster. And the difference here is that that disaster will live with you forever.
Greg's philosophy was really about the failing of professional integrity. For him, it was based on one of his own personal tragedies. For the rest of us, it is simply a warning about disregarded intuitions. Often, recognising why we do that is the first step to preventing those most human of disasters. But what was for sure was that I always turned to Greg whenever I was unsure. For example, one Monday morning, a 60-year-old man came to see me with severe right-sided back pain. He'd been chopping down trees in his garden, and such musculoskeletal pains are very common in general practice. I'd given him painkillers and advised him to rest. But he came back the next day, and then again on Wednesday. He was describing a writhing pain in his right loin, which meant he couldn't get comfortable, so I sent him for an X-ray of his back. But by the time he came back to see me on Thursday, his loin pain was radiating into his groin and right testicle, and he was febrile. I was at a loss as to what to do, so I called Greg into the room. Gregory took a cursory look at the X-ray. Then he said,
"When this pain comes on, does it make you want to lie completely still, or do you find that you just can't find a comfortable position?"
"Yes, I can't get comfortable," said the patient. "I just walk around restless, desperately trying to find a way to lie, stand or bend, to relieve the pain."
"Yes. Let's dipstick test his urine,"
said Greg.
"I think you'll find blood. I'm sure he has renal colic."
And with those simple questions he seemed to nail the diagnosis. We sent him straight to hospital, and the diagnosis of renal colic was confirmed. However, he had become profoundly septic. So a nephrostomy tube was placed and frank pus drained from his kidney. Several days later, his stone was removed by Mr. Dunsmuir, a top urologist. I gather that the patient nearly died before his nephrostomy went in. When I heard of his close shave with a septic death, I felt the blood drain from my cheeks. So, on that occasion, it was hats off to Gregory. Of course, distinguishing the differences between musculoskeletal pain and that of renal colic is not uncommon. Musculoskeletal pain often follows on from some kind of physical activity. If the back muscles go into spasm, they may cause an uneven pull on the bones and joints. The pain then originates from the nerve root. The spinal cord is housed within the vertebral canal. Each vertebrae is buffeted from the one below by a shock-absorbing disc. The nerve roots exit through the spaces created by the discs. Impingement of the nerve as it leaves the vertebrae can result in nerve root inflammation. In health, the disc space is well preserved. However, wear and tear can cause osteosclerotic changes with loss of disc space. Similarly, untoward activity can cause prolapse of the disc, which impinges on the nerve. Nerve root irritation can then cause pain to radiate from the apparent region that is supplied by that nerve. The testis is innervated by nerves entering and exiting the spinal cord at the level of the 10th and 11th thoracic vertebrae. The cremasteric muscle receives both afferent and efferent innervation from nerves emergent at L1. Similarly, innervations to the penis and scrotum enter and exit from the sacral region. Problems in the back and sacral spine can result in radicular pain to the groin, testis, and scrotum. This pain is often shooting, or tingling, or of a deep burning quality. It is made worse by movement, and relieved with rest. The pain caused by the passage of a ureteric stone is very characteristic. Each time the ureter heaves to move the stone along, the patient writhes in concert, mirroring the struggle of the ureteric tube. Pain from the kidney is felt in the loin. Afferents from the ureter enter the cord at the level of the first and second lumbar vertebrae. So, pain often radiates to the groin. The lowest reaches of the ureter receives innervation from the sacral plexus. It is not unusual for the pain of renal colic to be experienced in the testis, scrotum, or, in females, the labial region. The pain of renal colic is unique. The patient can't find a comfortable position. Often they are writhing with the pain, and the pain may radiate to the groin or genital area. Recall our would-be lumberjack. The pain had him doubled up, and it made him writhe and contort in agony. No matter how and where he moved, he could not find a comfortable position. And then, as the days passed, the pain moved to his groin and radiated to his testicle. I did joke with Gregory that his diagnosis was humbling to see. "Not at all," he replied. He then, momentarily, seemed to become somewhat distant. He muttered, mentioning his darkest moments. And then Gregory left the room, and he closed the door. But the years ticked by, and Greg and I always worked well together. My life at Oak Tree got busier and busier. My children were growing up fast, and I was struggling to balance work and family life. But then some strange things happened. In the autumn of 2011, Gregory's daughter came to work as a filing clerk in the practice. I didn't know that Gregory had a daughter. Like me, her name was also Kate, and strangely we seemed very much alike. She was 7 years my junior, and we got on very well together. She had just turned 23 years of age, and was going to start at medical school in London later that year. I knew that Gregory had had his heart broken many years before. He had been married to a girl in Australia, but the marriage had failed and Greg had returned home to England. His estranged wife had remained there, I believe, but I was to learn more of that story later. On Christmas Eve of 2011, Gregory popped into my room and, much to my surprise, asked if he could confide in me. "Sit down," I said, and he told me he had not been feeling very well and was convinced that he had found a lump in one of his testicles. I paused for a moment, feeling awkward yet flattered that he should choose to share his concerns with me. He recognised my reticence, and throwing his arms in the air, quickly effused, "But you are our resident expert in men's matters." So I put my inhibitions behind me, and I began. "When did you find the lump? Has there been any trauma of recent? Have you had any previous operations down below? Is the lump painful or painless? But no to everything." "I found it 3 weeks ago. It's painless and increasing in size," he said. In short, there are 3 lumpy things worthy of mention that are found in the scrotum: epididymal cysts, swollen epididymes, and testicular cancer. And so I examined him. I was feeling specifically for his testis and the epididymis, which is a separate structure. I was hoping to find an epididymal cyst, by far and above the commonest lump found in the scrotum. Epididymal cysts are discrete and separate from the testis. They are almost always painless. If a torch is shone through the scrotum from behind, they will transilluminate, as they contain fluid. Epididymal swellings are usually painful, and they are felt separate from the testis. And very rare is testicular cancer. These often feel hard and craggy. As these are arising from within the testis, they cannot be felt to be separate. Occasionally they will infiltrate the tunica vaginalis, and so a hydrocele will form. However, hydroceles are incredibly common, and in themselves not usually related to sinister pathology. Do be mindful of the features of a hydrocele. You cannot feel the testis as a discrete structure. You can get above it, indicating that it is not an inguinal scrotal hernia, and it will transilluminate with torchlight. It is a fluid-filled structure. But for Greg, I could not find anything wrong in his scrotum. "Are you sure?" he said. "I'm sure I can feel something." Then he paused and said, "Why don't you scan me?" Horror the thought. In advance I could imagine the snowstorm I would see. I couldn't afford to get this one wrong. But a preliminary check by me would do no harm. So I scanned him. Well, goodness me, if that is not exactly what I saw, a snowstorm. The ultrasound images did look just like a snowstorm. In actual fact, what I was seeing was testicular microlithiasis. Microlithiasis usually arises as a result of some sort of tubular dysfunction. But I wasn't really sure, and I certainly could not see a mass. "I'll organise for you to have another scan after Christmas," I said, indicating that I would get our visiting radiologist to do this next time he came to the practice. Furthermore, it would take the pressure off me and put the diagnostic responsibility elsewhere. But it was Christmas Eve. As we left Oak Tree that night and I turned out the lights, I noticed that the moon was full and shining low, and the dusting of snow was just beginning. The practice would now be closed for 2 days. My mind quickly turned to festive matters. But I knew that Greg was feeling uneasy. His Christmas stocking was already hanging in his home. But I think he knew of the horrors that were to be delivered to him on that festive season, not so long ago. Sadly, the scan that I arranged for Greg did not happen. A clerical error. Christmas excitements. I just don't really remember why. However, what happened next still makes me feel sick to the pit of my stomach. It was just after New Year, and I returned to the surgery late one night to drop off some paperwork. To my surprise, I found Kate filing some reports, and she joked, "My dad's pregnant." I was confused, so Kate passed me some blood test results. For sure, they were for Greg, and his beta-HCG was through the roof. This was highly irregular. I had not requested this test, and it was not right that his daughter should have such accidental access to it. In a panic, I put the results straight through the shredder. I said, "It must have been a mistake." Of course, as soon as I had done that, I had a foreboding sense that I had done wrong. What on earth had happened to my professional integrity and common sense? Indeed, it was several weeks later before the true significance of this disquieting event dawned on me. Greg had requested his own blood tests. He'd measured his beta-HCG because he was worried about a testicular lump, not because he wanted to have a pregnancy test. But silly as it may seem, it all makes sense when we think of how the testes work. Let us go on a brief tour of the testicular world. The testes are made up from thousands of tiny seminiferous tubules which make sperms. On closer inspection, we can see that the spermatogenesis proceeds towards the centre of the tubule in a stepwise manner. The germinal epithelium lines the tubule. The Sertoli cells are important in the spermatogenic process. The spermatogonia form on the basement membrane. These then develop into primary spermatocytes. Secondary spermatocytes are formed following meiosis, or reduction division, where the chromosome number is halved. Spermatids then follow. Ultimately, these mature into spermatozoa. Spermatogenic arrest can occur at any level. This can result in infertility, with the failure to produce sperms. Often, infertility is associated with a generally dysplastic germinal epithelium. On occasions, this epithelium may become neoplastic. Or, neoplastic cells may arise without any apparent pre-existing dysplasia. Testicular cancers are described in two classic forms: seminomas, which probably arise from spermatogonia, and teratomas that can arise from any cell type, and there is a spectrum in between. At this stage, all cells are totipotential. That means that they can form any cell type seen in the developing embryo. For example, hair, teeth, or skin. However, extra embryonic structures can form too. The yolk sac is drawn into the embryo to form gut-associated structures. These cells can produce the chemical alpha-fetal protein. Similarly, the syncytiotrophoblastic cells that form the placenta can produce beta-HCG, the pregnancy test. The highly malignant choriocarcinoma arises from these cells and is nearly always fatal. However, alpha-fetal protein and beta-HCG are the classic blood tests used as markers for non-seminomatous testicular cancers. I knew I should have told Gregory about his beta-HCG result, but I felt ashamed of what I had done. Gregory's choriocarcinoma progressed rapidly from a raisin-sized lump in his right testis to widespread systemic disease. Had he seen his beta-HCG test result in the new year, he would have been diagnosed a lot earlier. In February of 2012, a proper radiologist confirmed the widespread microlithiasis that I had seen. However, she also visualised the small echogenic mass that was Gregory's tumour. And of course, by then, he had systemic disease. For me, it was like my world imploded. I felt detached, as though I was floating above the practice with a sort of forlorn purpose. Before Greg began his chemotherapy, he told me his story. His professional life, he said, could be viewed as a film. And it began the year I was born. Gregory had qualified in 1981. He told me it had been a wonderful year. He took his Hippocratic oath, and he met his bride-to-be. She was a young Australian nurse who was travelling and working in London. They had dated, and then one night they went to see a low-budget film, and they had joked at the title. Gregory's Girl was a charmingly innocent film that told the tale of a fickle and awkward love. It chimed to the time and fuelled the sentiments of Gregory's soaring mood. Afterwards she had gazed at Greg and said, "So, Gregory, who is going to be Gregory's girl?" And he replied, "You are, Maddie." And that was it. They were engaged and got married. Greg completed his house jobs, and for the next 6 years he rotated through a variety of junior doctor posts in London and Surrey. But as the years went by, Maddie became homesick and yearned for a child. She wanted to take Greg home with her to start their family. And so, in 1987, they upped sticks and set off for a new life in Australia. For a life in the sun. For a life in the sun. For a life in the sun. And they tried for a baby, but one did not come. And the stress did tell as they failed to conceive. But at last she fell pregnant, and she led Greg to believe that he was the father, and all had come good. But he failed to be happy, as a new father should. The baby was born in late '88, a bonny wee girl, and they christened her Kate. But when Greg did his sperm test, on the secret you know, he collapsed with such grief when the results then did show. He didn't have sperms, the problem was clear, and he fell as a victim to every man's fear. A most ancient of torments that humans can face is to be cuckolded and lied to and tricked to embrace another man's child on the guise of his own. That was the horror the sperm test had shown. And the marriage then failed, though slowly at first. The breaking of trust was perhaps least the worst. Young Kate was their rivet and made things seem fine, but the truth of the union was borrowing on time. And when Kate was just 5, her mother did part from her husband of 12 years, and breaking his heart. And so home to his country, to England, he came, leaving Maddie and Kate, who took another man's name. And never was said who the real father was, although Greg had his notions, but was quiet because, as things all unfolded, and a cruel twist of fate, a tragic bereavement for another girl, Kate, and Greg felt to blame for the death of her mother, her potential young sibling, perhaps a young brother. Although just a fetus, they were both there to save, but the story was buried and rests in a grave. But for the rest of this tragedy, when I was a girl, is the ongoing story that soon I'll unfurl. And that was it, really. Gregory had a child, although he was not the real father, but he loved her. And although his marriage had failed, they'd kept in touch, and now his daughter by marriage had come to England, and they were reunited. But now he was dying. And of course he knew that. Most testicular cancers are curable nowadays, but the choriocarcinoma is a different beast. It rapidly becomes systemic and is fatal for most. Gregory had always had a dysplastic germinal epithelium. That is why he had microlithiasis and spermatogenic failure. Greg will have known all this, which will have intensified his concern when he found that tiny testicular lump. When I made light of his concerns, he sent off his own pregnancy test, his testicular tumour markers. But I denied him early knowledge of his fatal diagnosis. His diagnosis was delayed by nearly 2 months, and of course it was too late by then. The cost of my stupidity can never be known. In the summer of 2012, I went up north for a few days on my own. As I watched the sun set in the western sky, I was startled by a seagull that swooped past my balcony, and that was when I received a text from young Kate. Simply, she informed me that her dad had passed away peacefully late that afternoon. I wept for a while, and then I opened the letter that Greg had sent me several days before, and it reads as follows.
Dear Kate, much of what I told you about my life in Australia 25 years ago remains incomplete. I had once mentioned to you about my darkest day. Well, I'll tell you about that now. In 1988, I was working in Melbourne as a casualty doctor when a young lady came in with right-sided lower abdominal pain. I recognised her immediately, although she had no idea who I was. We were both English and loosely part of the expatriate community, and I felt sure that she was the woman whose husband was having an affair with my wife Maddie. But worse, I'd also wondered, well, you can guess what I wondered. I was taken completely off guard. I did not want to ask her personal questions, and I certainly did not want to take a sexual history from her. But this was a young lady of childbearing age, and all that would have been unavoidable. So I quickly concocted a putative diagnosis of appendicitis, so that I could hand her case rapidly over to the general surgeons. I didn't do the basics, and referred her to the surgical registrar, and then she was left unattended for over an hour. Not surprisingly, the surgical registrar was not impressed.
Look, Greg, she has no guarding, no localization, and no rebound tenderness. She's moving her central abdomen freely. She's not febrile, and she has no evidence for appendicitis.
Of course, he was right. Any inflammation of an abdominal structure initially causes irritation to the peritoneum. First, the visceral peritoneum is affected, and so the pain is vague and felt centrally. Then, as the parietal peritoneum becomes involved, the pain becomes localized. But the key point is this: peritoneal pain causes the patient to lie absolutely still. They do not roll around with the pain. In the case of appendicitis, the pain often seems to begin in the periumbilical region and then localizes in the right iliac fossa as the parietal peritoneum becomes involved. That lady, who was of course your mum, had none of those symptoms, and I knew that. If anything, some of her pain had been slightly colicky in nature, but with the pathology that she had, the symptoms are, really, often quite vague. And again, I knew that. When the surgical registrar had suggested renal colic, he was just batting it back to me. Blithely disregarding my own intuitions, it was convenient to be swayed by his suggestion. So I requested an IVP. Of course, the IVP was normal, but she seemed to get better anyway. You and your mother were waiting for your dad to arrive to take you both home. But what happened next was tragic. And the coroner's 5 minutes of disdain has haunted me forever.
Is not the pain of renal colic very characteristic? Is it not a writhing pain that causes the patient to move around, unable to find a comfortable position? Is there not blood to be found in the urine?
And on he went. I've heard the incredulity of the coroner's voice over and over again down through the years. Of course, I had not even done a basic urine test, let alone a pregnancy test. And the mantra is, any female of childbearing age with abdominal pain must have a pregnancy test. Deep down, my intuitions were telling me that I had it wrong. I knew that she did not have appendicitis. I knew that she did not have renal colic. But my professional integrity was compromised. I was swayed by the circumstance. If I had treated your mother like any other patient, I could have stopped the tragedy from unfolding. I was consumed by the thought that her husband, your father, had cuckolded my wife. I believed him to be my nemesis, and he got there too late. Your mother crashed and died, and I had to break the news to you alone. I apologised to you back then, and I apologise again to you now. If I'd done a simple pregnancy test, she probably would not have died. When I listened to you giving that lecture about pregnancy testing, just those few years ago, it was the first time that I'd seen you since you were 7 years old. I shudder at the irony. And I saw you just as you were back then, in 1988, a helpless 7-year-old girl whose mother had been torn from her by my own tortured pride. And there you were, as if on the stand, chilling me with the testimonial that has drained me through the years. But for my torment, there were no honest witnesses. My Kate was a baby when your mother died, and she broke and flamed my heart every day. But in the years that followed, I became haunted by the image of the unknowing witness. She sat silently on that little chair, reminding me of the lie that I must endure.
And again I found myself weeping. The sun was gone now, and the moon hung low on the starry sky. And then came Greg's concluding words.
Your mother may have died because of my folly, and your dad may be Kate's real father. But when all's said and done, you and Kate have always been my girls. My girls. My girls. My girls.
and then he signed off. I wanted to scream. I wanted to scream at the irony that I too had missed a pregnancy test. His pregnancy test. I had missed his tumour on the scan, and I had not followed through when I should. I had let him down. Whether or not he ever knew, I just do not know. However, he never said a word. And in the heavens that night, I saw a new star shining.